Hello, everyone. I hope everyone is happy and healthy today. I'm here to discuss with you a topic that you should already be familiar with, but I guess it's better to be safe than sorry. Everyone here has gotten a cut before, or scraped, or bruised, and I'm almost certain that everyone here has used a band aid before. But are you sure that you're using them correctly? I'm here to just give a simple demonstration on how to put on a band-aid after you had a cut, either on your finger or somewhere else. It's a simple demonstration, but an important one nonetheless. I've had my fair share of oopsie daisies and gotten cuts all over me, either from doing chores, yard work, Boy Scouts, camping, hiking, you name it, I've gotten a cut before. Luckily, that means I've gotten a lot of practice using band-aids. Plus, my experience as a Boy Scout means I've gotten some professional experience with first aid and its importance. Today, I'm going over a simple scenario where I'll show you what to do if you were cut on the finger, including cleaning it and putting a bandage on it. All right, starting with the setup. You're outside in your backyard, you're climbing trees or whatever, but tragedy strikes as you cut one of your fingers, which ends your playtime. What do? Step one, cleaning the wound. It's easy enough to just slap a band-aid on any cut after getting it, but doing so puts you at risk of infection and even more pain. Whether it be pus, swelling, or your skin turning into funny colors, an infected cut is no fun. All right, so you run back inside like the big kid you are, and you go grab your family's first aid kit. Now what? Before diving into the first aid kit, first and foremost, you should always wash your hands with soap, then focus on your finger. You wash it gently with room temperature or warm water, but try not to get soap into the wound as that could irritate it. Next, you need to stop the bleeding. You can take a clean piece of gauze, tissues, paper towels, and hold it gently against your finger until the bleeding slows down. If the bleeding doesn't stop, go to a doctor. Speaking of, little side note before moving on, you should know when it isn't worth to try and take care of a wound yourself. If your injury is super deep or gaping, it's caused by like a rusty or dirty object, or it's an animal bite or a human bite, you should go to a doctor, full stop. Moving on, take a closer look at the wound. Is it still dirty? Be sure to clean it thoroughly, even using something like tweezers to try to get any dirt that might be stuck in there. As a final step for cleaning, in general, you can put on an antibiotic or petroleum jelly on the cut directly, just to keep that area moist and prevent any scarring. Now, moving on to a child's worst nightmare, hydrogen peroxide. Now, some of you here might have had some less than pleasant memories with this stuff, where your parents would have used it on you when you had a cut or scrape. Can you and should you use hydrogen peroxide to disinfect the wound? Yes and no. Yes, hydrogen peroxide can disinfect the wound, and it's good at doing so. It also destroys healthy tissue and delays healing. You should really, in all honesty, just stick with washing your cut with water, as that is the option least likely to cause more damage. I only bring this up because small misconceptions like this, like these, could potentially lead to more harm being done. All right, part you've all been waiting for, the Band-Aid. You should grab the Band-Aid of your choice. There's a bunch of different Band-Aids that you can use. There's different shapes and sizes that are available depending on the size of the cut or where the cut is located. In this case, we'll use a simple adhesive bandage. Simply remove the bandage from its package with the little flaps at the end, taking the bandage out. Next, you take off the protective backing strips, these white things, covering the adhesive backing, being careful not to touch the sterile pad in the center. Once you do that, let's say the cut was on my finger here. Carefully situate the pad over the cut and gently smooth the adhesive down over your finger so that it remains secure right to your finger. And you can give it a little pat down just to be sure it's secure. Bada bing, bada boom, you're done. Be sure to change this bandage out regularly, usually once a day, or whenever the bandage gets dirty or wet. Now, first aid is it's an important skill that most people should know how to do, and I think most people already know simple first aid. Not everyone knows first aid. I don't know everything about first aid, but it's still important. But knowing first aid could simply mean knowing how to put on a Band-Aid, cleaning a wound, how to take medicine, or just knowing when to go to a doctor. Knowing what to do and what not to do is that key important skill. And in some cases, you might know what to do or what not to know, and you might not know what to do. But you can know what to do. You just need to do a little research. I hope this speech has given you an opportunity to think about the importance of first aid, no matter how big or small, and its importance in our lives. Thank you.